And back now, a Sunday House call, and here's an email. This one is from Jean, who writes, I use artificial sweetener in my 4 cups of daily coffee and drink 1 liter of diet soda every day. Some of my friends insist that artificial sweeteners are bad for one's health. Please settle this. Dr. Samadi, we've heard about artificial sweeteners for years.
Well, Eric, before we get into this, I also want to look at what this gentleman or patient is doing. 4 cups of coffee is okay, but you want to make sure that you cut down on the cream and the sugar right off the bat. A liter of soda a day cannot be good for anybody because it can cause dental cavity, it can cause osteoporosis, etc. Looking at the sweetener, look, there's mixed facts and data out there. There has been a lot of talk, and they have been under scrutiny of maybe this is causing cancer. That has never been proven. We've seen bladder cancer in animals, but we've never seen it in adults. Obviously, if someone wants to try to lose weight, this would be one option. I'm not sure if this is the best option. I still think hitting the gym, cutting down the portion is much better than taking some of these sweeteners. The other thing is, I'm sorry, Mark, for one, it can also increase some of the dopamine level. It can long-term cause depression and migraine headaches. So just watch out. You don't want to take this for a long time.
You know, I agree with David's point that if you're going to use sweeteners, you want to use them in moderation, because there has been some animal studies, even on aspartame, that maybe shows in mice increasing rates of leukemia. But overall, there's no consensus that sweeteners increase your rate of cancer. But I'll tell you one thing about sweeteners. There's also no consensus that they actually help you lose weight. Now, diabetics have to use them, but they can actually increase your cravings. And if they increase your cravings, you're going to end up gaining weight, which defeats the purpose. So use them in moderation. I wouldn't be frightened of them right now. Further studies always need to be done, but don't use them as your sole way of losing weight.
All right, we've been talking about it for years. All right, doctors, thank you.
That's